Now, how are you going to evaluate the child? How are you going to evaluate the child? And this one, a very important website, which we need to know. Children more than or equal to 4 years with symptoms of inattention, hyperactivity, and impulsivity. And children who may have these symptoms and, they come with social difficulties or poor school performance, you want to evaluate them. And the comprehensive evaluation includes medical, developmental, educational, and psychosocial assessments. Okay. And this requires input from parents, from teachers, and from healthcare providers. As I said, I'll take you to the Canadian assessment page. But let's finish the PowerPoint first. So, in your history, you've got to ask about prenatal exposures to chemicals like maybe smoking, perinatal complications, central nervous system infections like encephalitis, meningitis, right? Head trauma. You also want to find out about, is there a family history of ADHD or similar behaviors in other siblings or the parents or anyone else in the family? And physical exam, you want to assess their height and their weight and their head circumference and their vital signs. The reason is because we said that there are some other medical conditions which may be contributing to features which may present like ADHD, like thyroid disease, right? And check for dysmorphic features, neurocutaneous abnormalities. So things like stage Weber, things like neurofibromatosis, you want to check for those ones as well. And perform a full neurological exam. And then you want to do a behavioral assessment for these children. You want to look at the cause, the onset, how the ADHD symptoms are affecting their daily function, and use of specific ADHD rating scales. And then in your history, you also want to assess for milestones, particularly language development and observation of caregiver-child interactions. So you can at times bring them to the clinic and they just watch them, right? How is the child relating with the caregiver? Now, you also want to involve their teachers as well, where you have to review ADHD-specific rating skills, narrative summary of their classroom behavior, their learning patterns, their functional impairment, and you even want to see their report cards from school, how they do their homework. So you realize that when you're assessing a child for ADHD, there's a lot which goes into it. You want to even get input from their after-school programs as well. Is it that the child does not pay attention when she's in school because the teacher is not helping, or the behavior is similar in school and after school? And that is why you also don't want to use just one setting as the basis for diagnosis for ADHD. Doctors, please, are you all following me? Because it could be that there are some social factors in those environments which are causing the child to behave the way they are behaving. So you want to take history from both the house and the school, because it could be that the child feels safer in school. So while the parents are saying the child is impulsive and all those things, the teacher is giving a totally different report. And that's why you don't want to use just one setting to make that diagnosis. Now, because we're talking about the various rating skills, I want to show you. In Canada, so I'll just take you to google.com. What resources do we use to assess children with ADHD in Canada? We call it CADRA. CADRA. So CADRA, see. Okay, good. So please, doctors, you see it? I just want to make sure you see it before I proceed. CADRA. So it's CADRA, right? And the CADRA resource, if you click on it, boom, CADDRA. I'm not going to waste your time so much, but I'm just going to show you the assessment tools we use, okay? So the CADRA resource, this is what it looks like, okay? So if you want ADHD guidelines, if you want resources, they are all there. Okay, let's go to resources. Treatment update, ADHD questionnaire is good. So if you click on this, it's going to the evaluation forms we use. So remember that I told you that we need a teacher rating scale, we need a parent rating scale. So we'll just click on one of them and just review them. Okay. So, so in Canada, before you can, before you diagnose a child with ADHD, you really need to make sure that you are asking the right questions. So you print out all these for the parents, or you show them the website, they print out and they go and give a copy to the teacher. Okay. And when you go and give the copy to the teacher, basically it is this. The teacher has to fill all this. Does the child often fail to give close attention to details or makes careless mistakes in school or tasks? Does the child often has difficulty sustaining attention in tasks or play activities? Often does not seem to listen when spoken to directly? So then the teacher is rating the child. And the parents also have to do the same thing. So they have to indicate whether it is the teacher who is filling it or is the parent who is filling it, because you want both parties to do it so that you can put everything together. So doctors, this is a long form. I'm not going to waste your time about it, but I just want you to know that this is the form we use. It's called the CADRA form, CADDRA, the CADRA form, right? That is what we use. So if you want more information and more knowledge about ADHD, just go to cadra.ca, CADDRA. Everything is there. Okay. Now, what are the coexisting conditions with ADHD? They can have learning problems, they can have language disorders, they can have um, 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 autism spectrum disorder, which is a coexisting condition. They can have sleep problems, they can have emotional disorders like depression, anxiety, positional defiant disorder, and they can the assessment approach is to use broadband behavioral rating scales. So that was what I showed you, and mental health evaluations and consideration of environmental and psychosocial factors as well. All right, those are the things you want to pay attention to. And what about investigations? Most of the time, ADHD is a clinical diagnosis. After you've gone through all the rating skills, you can say that the patient is scoring very high on them, and therefore you're going to make the diagnosis. However, you also want to maybe do neurocognitive or neuropsychosocial testing in patients who present with very complex cases. You want to do speech and language evaluation. You want to do occupational therapy evaluation. You want to do blood lead levels. Remember that it was stated in the in the MCC objective, right? There are some cases where you may want to do some unique tests, like blood lead levels, like thyroid hormone levels, and genetic testing if necessary. If necessary, that's what you want to do. So I think we've already gone through this. And emotional and behavioral differentials of ADHD can be anxiety, can be depression, can be mood disorders, can be conduct disorders, or these can also coexist with the ADHD. And these disorders may mimic or co-occur with ADHD. Behavioral problems can be oppositional defiant disorder, conduct disorder, obsessive compulsive disorder, and use of broadband behavioral skills for preliminary screening. Okay, now I'm going to the psychosocial and environmental factors that may be differentials of ADHD. It could be that this child does not have ADHD, but the child is just coming from a stressful home environment. That is why you need information from the teachers as well. Okay. It could also be that the home environment is good, but the school environment is not appropriate. It could be that the caregiver of the child, be it the parent or the teacher, have mental health issues and they are projecting it on the child. So these are the differentials we're talking about. And we also have adverse childhood events. That's what we call the ACEs, where maybe the child might have gone through some physical, some emotional, some chronic neglect. and they may present as ADHD-like symptoms. All right, that's it. Now, before we move to the management, doctors, anyone with any question or contribution towards the class,